Hey guys, today Adam and I are here to talk to you about medial tibial stress syndrome.
Medial tibial stress syndrome is also known as a posterior medial shin splints. It's a very common injury among sports. It can be caused by um, overuse or repeated stress. Medial tibial stress syndrome is in fact inflammation of the posterior tibialis, flexor helix longus, and the flexor digitorum longus.
So I have some statistics here that I found throughout my research, and it showed that about 6.5% to 16.5% of running injuries is due to medial tibial stress syndrome, and medial tibial stress syndrome also accounts for 50% of the lower leg injuries. It's seen in runners as well as military personnel. The more specific runners that it's seen in are hurdlers, sprinters, and long-distance runners. It's also seen in athletes that are involved in explosive and jumping activities, such as dancers, gymnastics, basketball, football, tennis, and volleyball.
Some of the causes of a medial tibial stress syndrome. Some intrinsic factors are hyperpronation of the feet, hyperplanar flexion, increased basal BMI. Females are more prone to these syndromes, and then hips internal and external rotation. Some overuse of posterior medial muscles during the load and responsive gait, increased training, and change in footwear and/or surfaces.
It's also shown that if athletes are running on hard surfaces more, that it's going to be more prevalent. So to start the examination, for just clinical purposes, we would always palpate. The area will be tender. The manual muscle test will be weak. We could also look at length, and we would always want to rule out the squeeze and bump test to rule out my fracture. We're also going to ask them about the history. So either a lot of these are chronic issues. So that's going to be happening. It's going to be going on for a long time with these athletes. And they also might have training changes, such as, they've increased their training, or now they're training on hard surfaces compared to soft surfaces. The athlete will always present pain along the posterior medial and distal 1/3 of the tibia or shin. And the pain is going to be more diffuse, not localized. And the athlete will complain about pain during the beginning of their activity. The pain will stop once the activity continues, but then will resume again once the activity has stopped. In more chronic cases, the patient could experience pain throughout the entire activity as well as during rest.
Some other ways to examine to try to diagnose medial tibial stress syndrome is by weakness and tightness of the tibialis posterior, the flexor hallucis longus, the flexor digitorum longus, the gastroc and soleus muscles in the ankle. Passive stretch of the soleus, heel raises, and hopping on one foot will cause massive amounts of pain for the individual. The MTSS will not show up on any radiographs such as X-rays, but they can show up on MRIs. When you're in the clinic, the examiner will find heat, redness, swelling, tenderness at the site of lesion, pain along the medial tibial crest, as well as the muscle belly.
So to start with our treatment, the most common form of treatment would be rest. Rest is really the only thing that's going to relieve shin splints and help with the pain. Another form that they use is ice. NSAIDs, most common would be ibuprofen. Also, correct shoe fit could help the problem. They want to make sure that they have adequate and proper conditioning prior to activity. And they want to stretch the gastroc and soleus muscles as much as possible. Tight gastroc soleus muscles contributes to pronation, so it's irritating all those muscles in the posterior medial compartment. You're also going to want to work on strengthening the anterior tibialis due to the fact that the gastroc and soleus are tight, the anterior tibialis is going to be weak. You also want to strengthen the posterior tibialis, the flexor hallucis longus, and the flexor digitorum longus. Many athletes are going to come in with pain due to they have been inactive all summer or for a long amount of time, and they're going to start up with activity again, go too hard too fast, and it's going to have the condition pop up.
Some more treatments for the medial tibial stress syndrome. Normal length of the gastroc must be obtained for normal loading response during the gait cycle. Orthotics might help to correct the mechanical issues of hyperpronation. You may want to modify the activity to gradually return when an athlete is coming back from the injury. And then you can also wear shin sleeves or do a shin taping job to help prevent the onset of a medial tibial stress syndrome.
The shin splints and tape job are going to compress the area where the pain is, and having the compression is going to activate the sensory effect to help with pain. Other types of treatment that we could do are surgery, although in my research I found that they don't really know how effective it is, so I would advise against that. Another thing that I was reading that they've now recently have just tried are low energy shockwave therapy. Basically, this is shockwaves that are produced by pressurized air that come through a handpiece. It kind of looks like an ultrasound head, but not really. The air is going to be projected through the piece, and it's going to strike the skin at 15 millimeters of diameter. The waves are going to be transmitted through the skin as shock waves, and they're going to disperse through the tissues while using ultrasound gel as the conductor. The study that I found this from had two groups. One was just a training program group, a home training program group. The other had the training program as well as a low energy shockwave treatment. And they found that they had full recovery of medial tibial stress syndrome with the training as well as the shockwave therapy. It also showed that the improvements of the pain and the condition lasted at least up to a year with the shockwave therapy treatment.
And then just to sum everything up, medial tibial stress syndrome is a very common injury in athletics that is mostly seen in runners. It is commonly treated conservatively with rest, ice, and gastroc and soleus length to help with excessive pronation. And then there is also new research out there that are promoting other ways of treatment, such as low energy shock wave therapy.
Alright guys, here's our references. Thanks for listening. Sorry about all the music in the background.
Yeah, we hope you enjoyed all the music in the background.
And we'll see you guys on Monday. Thanks.